Today we are talking about 50% of the world, my favorite half of the world of men. Hi, I'm Dr. Rasya Dixit. I'm a dermatologist in Bangalore from the last 18 years. And today we are discussing all about skin health of men. We know that men have skin which is slightly different of that of women. The skin here of men is more thicker. It is also having more number of oil glands or sebaceous glands. That makes it more prone for acne, more prone for pigmentation because they spend more time outdoors. Now, also we have a challenge that men don't like to do skincare. Men think doing skincare is not good or not appropriate or not needed because they feel their skin is tougher and they don't need to protect their skin. But let's face it, skin is skin. So your skin also is going to undergo the changes of aging. The skin is also undergoing the changes of pigmentation, and it tends to wrinkle faster when it is being exposed to damage of sun and pollution. It's going to age faster. And we want to make sure that you are following the correct skincare routine to make sure that your skin stays its best. Let's talk skincare basics in men. Men don't like a large routine of skincare. They want to keep their skincare very precise and as minimum number of products. The first step in choosing a good skincare is to find the correct skin face wash for your skin type. So if you have oily skin type, you have to use a salicylic acid based face wash to cleanse the skin. But this doesn't mean that all men have oily skin type. There are a lot of men who have dry to sensitive skin type, and as we age more, especially as men come into their 40s, their skin type may change from a predominantly oily skin type to a normal to dry skin type. At this junction, you need to change from the salicylic acid face wash to a more gentle ceramide based cleanser. The second step is to use a sunscreen. I usually recommend a moisturizer cum sunscreen for my patients who are men because this cuts down their skin's routine by one step and they really appreciate it. So using a moisturizer with a sunscreen keeps your skin looking hydrated and protects you from the UV radiation, which is going to target pigmentation. It's going to make your open pores wider. So if you want to avoid the sun, please use a sunscreen. If you have really greasy skin, do use a gel-based sunscreen, which is recommended by a dermatologist. Make sure your sunscreen has an SPF of minimum 50% and has a Boots rating of 3 stars. The next routine is to do the night routine. So the night routine, usually we want to make sure you're cleansing your face with a salicylic acid face wash and starting to use a good niacinamide based serum to reduce the amount of inflammation that you have gone through the day. If you're in your 20s to 30s, just the niacinamide will do. Once you come into your 30s, you may have to add on either a retinol or a vitamin C based on your skin type and your skincare concerns. Exfoliation is often recommended for most of our patients using a glycolic acid or a mandelic acid cream once a week. This is a prescription product which your dermatologist will be happy to recommend to you today. Coming to the common skin conditions that men usually face. The first most common condition is acne because men tend to have more larger oil glands, more open pores, more acne prone skin, and the treatment is definitely two-pronged. One, using the salicylic acid face wash and the gels that I was talking about, but very importantly, change in lifestyle. Remember, the oil gland activity is directly related to your junk food intake, your sleep cycle, smoking, as well as alcohol intake. So make sure that you're watching all these things and pay good attention to keeping your lifestyle very strictly healthy to make sure that your skin looks its best. The second condition that we very commonly see in men is the formation of seborrheic dermatitis. This seborrheic dermatitis or dandruff-like lesions which can be seen as flakes on the eyebrows, on the sides of the nose and on the beard area as well. These are some things which are very common, again related to the same high cortisol behaviors like severe stress, also eating too much high sugar food, not sleeping enough. These could make these seborrheic dermatitis much worse. This condition can be managed very easily by using an antifungal miconazole-like gel to be applied on the treatment area. To know more about seborrheic dermatitis treatment, speak to your dermatologist today. Now we come to grooming. Men love to have mustache, beard, hair. but these need their specific hair care products as well. So it is not just important to grow the hair, but also cleanliness is equally important. Because the oil gland activity is more in the scalp as well as in the beard area, formation of dandruff or seborrheic dermatitis is very common, especially in the winter season in India. So make sure you're using your ketoconazole based shampoo on a regular basis. You can also use prescription based medicated shampoos for the cleanliness of the beard as well as the scalp on a very regular basis, every alternate day, if not every day, depending on the level of your physical activity. If you are somebody who goes to the gym every day and you're sweating a lot every day, you may need to use the shampoo as often as every day. Make sure that you're eating healthy, more fruits, more vegetables to control the amount of oil secretion in your scalp and face. This is also going to keep your skin away from seborrheic dermatitis. Finally, coming to the in-clinic treatments for men. We are seeing more and more men approach dermatologists for a skincare routine as well as for some kind of intermittent treatments which can make them look their best. And among these treatments, we do recommend hydrofacials which can deep cleanse your skin. We do recommend dermapen or derma roller treatments to increase the collagen so that the skin appears more tighter, the open pores look more closed. We also recommend some gentle chemical peels which can refresh the skin and make you look less tanned. After your 40s, do think of treatments like HIFU or high intensity focused ultrasound, which will tighten the face and keep your face from looking saggy. And remember, small thing goes a long way. So make sure that you're not skipping the basic skincare, moisturizer, sunscreen and face wash on a daily basis, along with the very three important attention to diet, lifestyle and sleep that is going to make you look your best for a longest time. So if you think this was helpful, do like, share and subscribe, and leave a comment below if you have any specific question that you would like to ask me.